Hi there, I'm Jeff Smith, and this is Leading Edge. What if some of the biggest questions about government spending in Ohio were hiding in plain sight? A 2-year investigation by Daily Wire reporter Luke Rosiak is raising questions about billions of dollars flowing through Ohio's Medicaid system. Questions about oversight, accountability, and whether warning signs were missed. The investigation reached Congress this past week, but today we want to start with the numbers. How much money are we talking about, and what exactly did one reporter find when he started digging? Now, exclusive to this market is my full conversation with Daily Wire investigative reporter Luke Rosiak right here on Leading Edge. I want you to put some numbers on it for our viewers. How much fraud are you alleging we're talking in terms of dollar amounts?
Well, so the Ohio Home Healthcare Program costs over $1 billion a year. And one of the things that stands out in the data is that 15% of all home healthcare spending goes to 2 zip codes in Ohio. And so that doesn't prove that all of that's fraud, but it highly suggests that people in a certain community are pretending to be sick, because you wouldn't expect there to be such a big disparity between how many people can't get out of bed in the rest of Ohio versus in Northeast Columbus. And so when the Department of Health and Human Services released a database that had data about who was getting paid, which companies were getting paid, and where they were, that was one of the things that popped out to me as a national reporter. The disparity was so wide that, me being in DC, it just popped up off the charts that something weird was going on in Ohio. And later on, I didn't really know anything about Columbus. I found out that Columbus, and Northeast Columbus in particular, was the big Somali community and also Bhutanese. So that's kind of interesting, because that's also, of course, what happened in Minnesota is when they had weird stuff like the autism rates jumping up 6,000%. That also was in the Somali community. So, it kind of raises questions about whether there are these close-knit communities that may be running a scheme where they have doctors and old people and providers in on it, and they're pretending to be sick, and they're causing the government to pay a company to then pay their family member to hang out with them or watch them or cook for them or clean for them. But that person may not actually be sick. And that adds up to quite a bit of money. And it's very difficult to verify whether any work is really being done, because, of course, you're talking about usually a family member just being in their house with their older parent.
Yeah, you testified this past week in D.C., and Democrats were accusing Republicans of trying to score political points on immigration in order to distract from greater corruption, they say, in the Trump administration. You saw the reporting today, being Wednesday. What do you have to say to that?
I was really surprised that the Democrats didn't engage more. Maybe I should just be more cynical than I am, but I thought that we all cared about fraud. Like, it's clearly, if anybody has read my articles in the Daily Wire, I mean, there are like hardcore career criminals who are being greenlit to run these companies that are paid millions of dollars. And all you have to do is look them up in public records. I mean, nobody has disputed what's in my articles. I mean, I put the people's names out there. They're hardcore criminals with repeat fraud convictions, felony convictions for defrauding the federal government, that kind of thing. And so it's really wild that we're then trusting these people to say, here's an invoice. I went to this little old lady's house last Tuesday at 3:00. Just trust me on that and pay me a bunch of money. And yet the Democrats really tried to change the subject. And, I don't see why it's partisan. I mean, it is a Republican state. This did happen under Republicans' watch. So it's not really trying to score pro-Republican points. On the other hand, the Republicans at this point in time, some of them are at least trying to address it. And the Democrats are literally saying, like, if there's fraud, then it's somebody else's fault. They're like, all right, it doesn't matter, though. Like, we're talking about a ton of money. Medicaid is nearly half of Ohio's general revenue fund, and it's doubled in the last 10 years, even though enrollment has been basically flat. So there's a huge budget problem here. Ohio is going to be bankrupt if they can't figure out what's going on. And I think it's a little silly to then grandstand in a hearing talking about unrelated stuff like President Trump's ballroom. Like, come on, we have a topic for this hearing. There's credible evidence that Medicaid dollars are being wasted. Let's get a handle on it so that the state doesn't go bankrupt.
One report out there said some Democrats were barred from the hearing, the chance to question you. You know anything? Is that accurate? Do you know anything about that?
It's weirder than that. So I did the opening statement. I was the first witness to talk, and there was a Representative Brown, who's from the Cleveland area. She's not on the committee, but she showed up anyway and sat down on the dais where the committee members were. And then while I was reading my opening statement, she started shouting and saying like crazy stuff, trying to drown me out so nobody could hear these facts. And I'm like reading off the names of people who this guy like Roshan Adkihari in Columbus is a guy that he literally flies on private jets, drinking champagne. He's got a yacht. He's made all this money off home health care.
You've said he's got like a rapper lifestyle.
Yeah, like I'm just going into details that anybody can verify. I'm going in the weeds on details here about policy. And she's basically like a wedding crasher of a committee hearing. She shows up, she's not on the committee, and she starts shouting out the witness. Meanwhile, the hearing has just started, so nothing that you can't really even argue that anything controversial has been said. The hearing has just started, and she's already objecting to it. And so when people say, like, do Democrats literally like not even care about fraud? I mean, to be honest, this woman, Representative Brown, I mean, she didn't make a great case against that, because I don't know why you would object to a hearing about Medicaid fraud. Medicaid fraud clearly exists. There's been a lot of fraud convictions on it. And recently we're having transparency around this program that we didn't have before with this database that was released. And it's just revealed some really shocking things that I think anybody who's in charge of the government should care about.
That was released in 2024, one of the last, renderings you said from DOJ before the disbanding of DOJ. Let me ask you, after 2 years of investigating this, what's more disturbing to you, the possibility that fraud occurred or the possibility that it appears nobody was looking for it?
It's a great question. So this data was released in February of 2026 by the Department of Health and Human Services. And sometimes DOJ is credited because they were very into data and stuff. So I've been looking at this for like 3 months now, and you just look at in public records. Like, I don't have any like super secret information. I did basic. I'm pretty good at looking stuff up in public records, and I can figure out if you've had if you haven't paid your taxes. I can tell if you have other businesses that you're involved in, criminal records, that kind of thing. But I just did pretty basic vetting of these companies. The only missing piece we didn't have before is the names of the companies. And now that we know the names of the companies that are paid $1 million a year, $10 million a year, you look them up and it's like, what? These are the people who the Ohio Department of Medicaid chose to let open companies. They're people with criminal records. There's one of the companies was opened in the name of a teenager who was living in Canton, and the thing was in Columbus. And I was like, that's weird. That's like 2 hours away. Oh, the teenager is the son of a convicted money launderer who just got out of prison. And so they just put the name, the business in the teenager's name, so that there's not a criminal on the paperwork. This is something that Ohio, you think they would have wondered why a teenager was running a business, like $1 million business.
Is that just not somebody's job to be looking for this, or there is somebody whose job it is to look for this?
That's a good question too, but I don't know. I mean, it's like, is it allowed that you're a criminal? Like, I don't know. I know they didn't check. In other cases, it's like one of these guys was convicted of a federal felony for defrauding the federal government, claiming he did services for old people and he had made it all up. And then his wife starts a company, and the government pays her $6 million. And she's using the same address as the husband. She's got the same last name as the husband. And it's the same exact thing that the husband was previously convicted of. And they're like, oh, this is fine. And I don't know if they're saying, well, she didn't personally have a criminal record. But to the obvious person, the husband is behind that. To the average person, the husband was probably behind that business too. And Luke, so this woman got paid $6 million. The husband still hasn't paid his restitution. He's claiming he doesn't have the money.
Luke, you also had a case there, and correct me if I'm wrong, but you had an individual who had a tax lien for like $30,000 or something to that effect and opened up a home health care LLC, and in the first month got paid that $30,000. Am I on the right track there?
Yeah, I mean, what they will do are there are companies that will show up in Medicaid, bill $30,000 in their first month, and then never bill again. It's like there are other companies that there was a janitor. She had this janitorial company in Columbus, and she just changed the name of her LLC. It was literally the same company, and suddenly it changed names to be like One Community Mental Health. And so she bills $100,000 in the first month, providing Medicaid counseling services. And then later on, it gets up to like over $500,000 a month. And then she just leaves the country and goes back to the African country that she came from. And so it's like if you were building a business, you have to advertise, you have to slowly attract clients. In what world is it normal to open a business and the very first month you bill $100,000? There's all kinds of insane stuff that's been in plain view of anybody who looked at the data. And until now, it was just the Ohio Department of Medicaid and maybe some other law enforcement agencies that got to see it. And so I think your question is a great one. Like, were they even looking? Because these are massive amounts of money. I mean, you or I will never see the amount of money that some of these people were making in a single year.
Right. So let me turn the focus to county commissioners, city leaders, local taxpayers. Should they assume this is just a Columbus problem, or do you believe this is a statewide problem? And obviously, from a national scope, 30,000-foot view for you from D.C., but looking back here in the Buckeye State, we're looking back here at home.
Yeah, that's right. And I mean, I think that when 15% of all of all home healthcare spending is taking place in 2 zip codes in one little corner of Northeast Columbus, that's not fair to the taxpayers in the rest of the state. It doesn't make any sense that people would be sick that much more in the Somali neighborhood than all everywhere else. And so they're taking money away from the people that really need it, who the program was originally sold as benefiting, like 95-year-old people that can't get out of bed. And so it may be that there's no more money for this program, or that the government can't trust people not to abuse it, and they got to shut down the whole thing. And that's one of the real risks here for the people in Toledo and elsewhere, is if this program goes away, they need to understand why. It's because basically Somali and Bhutanese fraudsters in Columbus kept bilking it for hundreds of millions of dollars, and nobody stopped them.
So you found what you described as hundreds of Medicaid companies connected to a handful of addresses. And you've got to, folks, if you haven't done it yet, go on and read the 5-part in-depth investigation that Luke has put forward. Now, if I gave you one afternoon in Toledo, where would you start looking here?
Well, I'd have to start with the database, honestly, and look at where the money was going. But then you can look up the people that own these companies and see what kind of background they have. And what I found in Columbus, at least, is that a lot of them had other full-time jobs. This was a side hustle, if you can believe it, just getting $1 million a month from Medicaid while you're busy driving a truck or something like that. But this is basically they're not nurses, they're not medical personnel. That's one of the things that's been exploited in Ohio, is you can pay actually your own family member to be your aide. And so you look at potentially doctors that maybe they're getting kickbacks, or maybe they just don't care very much and they're willing to sign off on a lot of people being sick.
And it's a loophole. It's a loophole in Ohio law, is it not?
It is. And so that's where you get into, like, some of this is, you could call it waste or abuse. Some of it is fraud. I tend to think that most of it could fairly be called fraud, because I think when you go to the doctor and you claim that you're super sick and you're not, that's fraud. And at the core of it, there may be other stuff going on: corrupt doctors, kickbacks, no-show jobs, where people claim they have different little old ladies that they go see and they're not actually going and seeing them. That's all fraud. But at the end of the day, to build the program, there needs to be people in Ohio who are going to these doctors and claiming to be really sick. And then there's doctors that are writing that report. And so I think it is happening. Basically, these are state policies that allowed it to happen. And then Columbus is just disproportionately abusing the system But what we really see it in is these ethnic communities, and specifically the Bhutanese. And it's one of those things, of course, the Democrats try to say everything is racist. To be honest, I couldn't point out Bhutan on a map. I'm not like a known like anti-Bhutan guy. Like I have no reason to be like, the Bhutanese are up to it again. I don't know anything about the Bhutanese. All I can tell you with certainty is they are the ones abusing Medicaid in Ohio. They're doing it at scale. They're doing it
It's just a fact.
systematically. And you know, we can walk through all the details with anyone who's willing to see it, but I don't think that it's for people to just brush it off as anytime you say a minority is doing something wrong, I'm going to write you off. Like that's not a good way for Representative Brown to govern. Excuse me. You know, and one of the things is that the major organizations
And you're referencing, I want to point out for the viewers, you're referencing something that was said today, Wednesday, in the testimony before the congressional hearing. It was once again put out there. The representative you're referring to said it's hurtful, the things that you're saying about this group of people.
Yeah, and also the state minority leader. Do you remember her name?
I would have to look that up. I don't have it at the ready.
Yeah, I don't remember her name either, but she had this weird thing at the end where she claimed that she had tears in her eyes because of whatever was said at the hearing, which I guess was her trying to claim she's offended. But, you know, my stories go into great detail about specific home healthcare firms in Ohio that will actually share an address with a charity that's designed to send money back to the country of Bhutan. And there's one family, the name Adkihari is the last name. That's a Bhutanese last name. They've been paid $350 million just in Ohio in Medicaid money. That's a tenth of the GDP. That's a tenth of the GDP of Bhutan. And so there's a reason why the people from these certain ethnic communities are doing this. They're literally using it as foreign aid to their country. And so you have specific charities, which I name in my story, and they're linked to these Medicaid firms, and they bill. Basically, you have 81% of Bhutanese people are on welfare. And part of the reason I think so many are on welfare is that allows them to use this home health service and trigger a payment to a company that's owned by one of the 19% that's not on welfare. And so the Bhutanese are running this scam that allows their own friends to get paid by Medicaid, and then they send that money back to their country. And it's, again, at least 10% of the GDP, and some of it actually funded a party at the president of Nepal's house, if you can believe it. And this is what Ohio taxpayers are paying for with a medical program.
Well, that's what I was just going to ask you. How much of this money originated, you think, with Ohio taxpayers, and how much originated with federal taxpayers who may not even realize Ohio is where their money was going?
That's another great question. And part of the reason why Medicaid fraud, and it does exist at quite a great scale, is part of the reason Medicaid fraud got so bad is because the federal government pays for most of it, like 70% now in a lot of cases. And so the states, frankly, didn't care that much. They didn't have as much skin in the game. And the states have actually manipulated the feds. It was supposed to be like a 50-50 split, but the states started doing all these loopholes. You know, if you could almost call it money laundering practically. It was pretty sketchy what they were doing to put more of the burden onto the feds. And then there were states like Minnesota where Governor Tim Walz really didn't care necessarily if the money was going to fraudsters, because it's like, it's not my money, and maybe it'll somehow trickle down and boost the general economy. But even that doesn't hold true if it's literally leaving the country. And there's a strong connection between actually the Somalis and in Columbus and the Minneapolis ones. They're one and the same. They have families in both places. They're often moving back and forth. They will own businesses in both places. And we know that $130 million of cash was taken in briefcases from Columbus to Minnesota and then to Somalia. So you go to these buildings, they're all foreign, and there's a reason for that.
And you pointed out a lot of the same last names, and, you know, it kind of smelled suspicious from the get-go. I was struck as well by some of the times when you and your team, you went up to buildings that looked desolate, and you found that there were like 88, I think one of the counts, 88 or some, or maybe 90 different LLC, Medicaid, healthcare LLCs in that one building. Let me ask you this, and I'm sure you're not done with the investigation in any stretch. Did you uncover bad actors exploiting a good program, or did you uncover a program designed in a way that almost guarantees abuse?
I think it's the latter. I think that taxpayers should be really uncomfortable with a program where if fraud does occur, it's almost impossible to prove. And that's what we're talking about here. We're talking about paying people to hang out with their own families. And in the best case, maybe the person is dying, they can't get out of bed, they're paralyzed. And so we were told that it would be cheaper than sending them to a nursing home to just pay their family to like wait on them. But the problem is not a lot of people were pretending to be sick so that they could go live in a nursing home. Not too many people want to do that. It turns out a ton of people want to get a free paycheck for their family members. And so they're pretending to be sick. And then you have people who claim to have a whole roster of old ladies who they go and visit. But it's very, very difficult to prove that anybody went to a particular place. And if they're living with them already, it's virtually impossible to prove that they actually rendered any services. What I hear about a lot of times is the old ladies who are sort of the matriarchs of the family in these intergenerational immigrant households. They're the ones who are ostensibly being cooked for and cleaned for by the younger people that are getting paid by the government. But actually, it's the old lady who's doing all the work. She's the matriarch of the family. She's the one cooking and cleaning for her 30-year-old son. So I don't think that we can necessarily have a program where it's impossible to prove that anybody did what they said they did, because it's happening in private residences. And it may have been the kind of thing that worked despite its flawed designs in previous decades and now does not work because we've brought people in from low trust societies, frankly. And maybe the Democrats get offended by that. But like, if they wanted to have these big government programs, maybe they shouldn't have brought in the people that will abuse them, because it's just the truth is, I mean, you can see it in the budget. Ohio can't afford to keep this up. It's doubled in the last couple of years. People are getting sicker and sicker on paper and need somebody to come wait on them. And it's really because people are increasingly dishonest. That's just the world we live in.
Luke, let me ask you, and I don't know how many team members you had helping you with this, but was there that one moment where you're like, get out of town? I cannot believe that number is accurate. What was the one that kind of blew you out of your seat as far as what was being frauded per month?
I think it was how common it was. And I want to shout out to a colleague, Parker Thayer, who actually doesn't work at the Daily Wire with me. He works at the Capital Research Center, which is a great think tank that really gets in the weeds with data and numbers and stuff. And we were looking into a guy named Robert Achiapong, and he was a total scammer. And then we found a different person named Roberta Achiapong, because we assumed they were related. And they were both Medicaid scammers in Columbus, but it turns out they weren't even related. It's just, that's how common it is. You pick seemingly any African in Columbus, and it turns out that they've got a multi-million-dollar Medicaid business. And, just the sheer scale of it and going down these rabbit holes. I've done 5 parts so far in my investigative series. This could go on forever. I mean, I probably won't. People will get tired of hearing the same story with a new name, but it's almost infinite. You look up any number of people in Northeast Columbus, and they have multiple medical companies. They're also working a different job. They don't pay their taxes. They have criminal records. And it's just like, nobody really has known this was going on because they don't interact with regular Americans. They have their own sort of parallel society. Nobody sees them. But one thing's for sure, we know now, because of this government spending database, we were very much paying them. And so, I think that if there was an holy cow moment, probably seeing the guy, Roshan Adgihari, on a private jet sipping champagne really crystallized it for me, because these are people who came to our country as refugees, and we took them in out of the kindness of our hearts. And now that company of the guy on the private jet hasn't paid its taxes in 5 years. It's got $17 million. His 25-year-old brother has a company that got $10 million. And it just doesn't seem like the way that a bona fide refugee, and certainly not one with gratitude to the country that took them in, would act.
Luke, you alluded to it a little bit. Republicans control Ohio government. Democrats aren't running state agencies. So who owns this problem? Who fixes this problem?
So I think that it's kind of silly for the Democrats to act like it's a Republican thing. Definitely, it's the Democrats who want to expand Medicaid and did expand Medicaid to be this home health stuff, and who also try to stop anybody from looking into fraud when it involves refugees, even though the fraud is clearly real. At the same time, Mike DeWine is very much responsible for this. He's really screwed it up in shocking ways. For example, there used to be a rule that you had to use GPS. There was a cell phone app that had GPS, and it was supposed to track for those people that were supposed to go to multiple little old ladies' houses and cook or clean for them. And the app would report whether they were really there. And Mike DeWine took that rule away. And the attorney general
DeWine says there are audits, there are electronic verification systems, investigations, safeguards, you name it. You say it's not working, right?
Yeah, it's funny because when my first story came out, DeWine said, "Oh, there's nothing to see here." And then when the second story came out, he's like, "Oh yeah, this is bad, but we have systems in place." And then when the third story came out, he said, "We're going to activate these systems." And it's like, wait a minute, you told us you were doing this already, and now you're saying you're going to fix this by turning on these systems. And that's when, and I wrote a whole story detailing how he had previously misled people. And he said, we're doing electronic visit verification, when in fact, Congress required Ohio to start doing this electronic visit verification way back in 2020. And they still didn't finish doing it by last year. And they called it electronic visit verification, even though they took out the only meaningful part, which was the GPS. And so now DeWine says he's going to do these things moving forward, but it's hard to take that seriously when he previously claimed he was already doing them, and it was just filled with loopholes that really, it's like, why would you insert those loopholes? If you're paying somebody $1 million a year, it's not that unfair to ask that they just to let us know that they actually went to work. I mean, this is what we all have to do. We have to prove to our bosses that we did a job if we want to get paid. So there was a remarkable lack of oversight, and I think that DeWine ultimately is over top of the Ohio Department of Medicaid, which failed to do background checks on these people, or worse, they knew they were criminals and they let them open multi-million-dollar businesses anyway.
We've got a few minutes left. We're going to make this entire thing available to our online audience, by the way, Luke. So what if somebody's sitting at home and they're like, I'm calling BS on this? What do you respond? If you're walking down the street and somebody says, oh, you're that guy from the Daily Wire, and I think you're full of it.
I like to go to specifics in that case. And sometimes people will, you got to take the time to read the articles if you're going to claim it's not true. And you can go to read the articles. Let's read off a couple names here. These are just people, again, just people with the last name Adki Hari have been paid $350 million from Ohio in the last couple of years for daycare and home health. So Dilly Adki Hari, $250 million, just one guy. He had to pay a fine to the Department of Labor for underpaying his people. He also runs a foundation which sends money to Nepal. Nirmala Adki Hari, $21 million for a company called Medina Home Healthcare. I went there. There's nobody there. We can get really specific, and nobody has really countered any of these examples. And I think that they need to explain why it is that so many people who own these businesses are making so much money, where it's like, you're like the CEO of a Fortune 500 company, the amount of money these guys are making. And they have no training, no work experience. They're doing this part-time. And why is it only happening in certain neighborhoods and not everywhere else?
Let me ask you, what's the most shocking thing that you found you couldn't prove or haven't been able to prove yet?
So with a lot of these people, it's like, are they really going to these, let me think about that. There's a lot going on here. It's so complicated, so much money flying around, and I'm reluctant to speculate on things that I haven't been able to put together just yet. But I think that putting aside
what I alluded to, though, you're not close to being done with this. And when I emailed back and forth with you, I said, does this go beyond Columbus? And your answer was,
yeah. So it absolutely does. And you know, the Adkiharis are mostly in Cleveland. So the companies I just mentioned. So the Nepalis, they're the Bhutanese / Nepalis. They're around Reynoldsburg, but also Cleveland. And then they also own companies in other states. So yeah, I mean the Bhutanese story is a weird one because there are a lot of good Bhutanese, and the Bhutanese speak. Basically, it's this one faction within Bhutan that has a reputation for kind of being scammers anywhere they go. And Ohio wound up taking in 2,000 of them, but then 28,000 others came and joined them from elsewhere in the country, specifically to start billing Ohio Medicaid. And they had a party in Cleveland, I think, like a couple of months ago. Like 15,000 people went, and so many people there own their own Medicaid companies that they were busing in attendees on with their Medicaid vans. And there were people there that made like $183 million from Medicaid just buying free food for everybody. And so I think it really would shock Ohioans that the people that they were told are refugees, actually people from Bhutan and Nepal will tell you, oh, this is what you guys got, is like basically this gang that took over. Like, we didn't want them because they're criminals, and now you guys have them and they're running a scam on you. And I think that the dollar amounts are just so high. You know, I've been an investigative reporter for a long time, and usually a couple $1 million, that's a lot. But these are like hundreds of millions of dollars. And I think it's just because in the once you put it in the medical bucket, like medical, anytime you go to the doctor, it's always so expensive, right? So if you put this in the Medicaid section of the government, the insane amount of money kind of flies under the radar, but it's really shocking. And nothing that they're doing is even medical. It's called personal services is the technical term, because they're not nurses. They're not giving you medicine. They're literally just housekeepers and even billing for conversation and companionship. And so there are a few cases when this was sold to us for a certain reason, very narrow cases where somebody is on the verge of death and this avoids putting them in a nursing home. But it clearly hasn't worked that way, because we're actually losing a huge amount of money, not saving money, versus putting people in nursing homes. And so now I think policymakers at the state level and also federal have to think about, does it make sense anymore to pay people to hang out with their own family members? And there were people in these buildings in Columbus, and I would ask that, like, why wouldn't you help your own mom? Like, who wouldn't help their own mom? Like, that sounds crazy. Like, you're not very sympathetic if you wouldn't do a favor for your own mom once a week by cooking her supper. And they said, well, we probably would, but I mean, if we can get paid for it too, why wouldn't we? And so I mean, you can't really argue with that, I guess, except that most of us don't want to bankrupt our own civilization. Let me wrap. So that's a question here: is would they be doing this for their families anyway without getting paid? And if so, why are we paying them? Let me wrap up with this last minute. What is the question every Ohio taxpayer should ask their state representative Monday morning? Should we, what are you doing about the home health personal services program, and how are you going to get this spending under control? Do we recoup that? Is that money gone? I think it's literally out of the country. And I think that there are so many, obviously some people could be prosecuted, and that would provide a deterrent to the others to make them stop doing it. But I'm kind of skeptical. Like, if you wanted to prosecute all these people, you'd be working for 100 years on it. That's how many of them there are. So it may be that policymakers discuss winding down this program or limiting it to only cases where you're like, you're paralyzed, something crazy like that. And we're only talking about Medicaid, by the way. If you're on Medicare or private insurance, that's different. But these are people who haven't paid taxes, and then they're asking us to pay their own family members to cook and clean for them. And it may be that, unfortunately, this program has just been so abused that we can't do it anymore. Luke, I gotta thank you for your time. I do want to ask, finally, I said my last question was final, but in just 30 seconds, J.D. Vance has talked about this a lot. Vivek Ramaswamy has talked about this a lot. Do you have faith that from your investigation, your investigative piece, there's action following? Yeah, I've been really impressed by people across the board for being responsive to this. And again, I think it just may take not only fraud prosecutions, but also policy changes.